PTSD can be treated in a number of ways, but the most successful treatments tend to occur with the use of psychotherapy. Specifically, some of these treatments could include prolonged exposure treatment or cognitive processing therapy, or EMDR, which stands for eye movement desensitization and reprocessing. The core theme behind a lot of these types of psychotherapies is helping somebody become more comfortable with tolerating the anxiety that they feel as a result of the trauma that occurred and their symptoms of PTSD. And as they get better at tolerating that anxiety and reducing their fear reaction, we help them to go over some of their memories of what happened and their thoughts or belief systems about what happened. For example, earlier I was referring to the feelings of guilt or responsibility, which were slightly distorted, and we help them reprocess those thoughts and memories so that they can no longer be as affected by both the anxiety and their thinking about what happened. There's also medication that's available, but the first line of treatment for PTSD is psychotherapy, but there's growing advancements with the use of psychotropic medication, including SSRIs and even medications that have been used for blood pressure, which have been found to help with nightmares. Of patients that actively engage in and complete treatment, including the psychotherapy types of treatment I mentioned earlier, we could have a high degree of success rate, sometimes as high as 80%. However, not all patients who start psychotherapy or have PTSD engage in treatment, and so sometimes the numbers can be significantly lower, around 40%, for example. The progress that's being made in treating PTSD is quite extensive. As I noted earlier, only in the last 30 to 40 years was PTSD really looked at as a major diagnosis. And so there's been a lot of advancements with the development of the treatments I mentioned, such as prolonged exposure and cognitive processing therapy. There's also growing advancements with the development of medications. Additionally, there's been a lot more recent attention paid to biomarkers of PTSD and looking at any genetic vulnerability for PTSD as well. In the aftermath of a diagnosis like PTSD, we know that it's not only the veteran that can be impacted by the PTSD, but in fact the family members can struggle as well. So for example, if you think about how some of the symptoms of PTSD manifest, there's that irritability that we talked about earlier. So that could come out through increased anger or yelling that might cause tension and stress in the home. There's also a degree of trying to control for threats and prevent negative things from happening. What we call sometimes hypervigilance, a sense of being very on guard. And so sometimes in an attempt to prevent negative things from happening, a veteran may limit the types of exposure that the family can have to regular social life, such as going out to friends or public spaces. So children maybe aren't able to enjoy things as much as they ordinarily would. For example, one veteran that I worked with really felt badly that his children weren't as able to enjoy going to carnivals or circuses because he didn't feel so comfortable taking them there. So he, through the course of our therapy, we worked together to help him and his family open back up the activities that they used to enjoy.